Yeah, I think that the vast majority of patients who wind up with a diagnosis of mast cell activation syndrome had dysfunctional mast cells from an early age. And the question is, I mean, that's a whole other topic, but the question is, what made them dysfunctional at an early age? What exposure, what toxin, what infection, what changed early in life that caused these mast cells to mutate a little bit, that over time then mutated more and more, essentially, with each subsequent exposure, until the mast cells are now just so dysfunctional that it becomes harder and harder to control and get them back to a sort of a baseline level, right? So I think it is a progressive condition. And I think that based on some of the research and publications that I've been involved in, when especially looking at the chemical intolerance side of things, that we now starting to understand that mast cells are involved in the development of chemical intolerance or toxicant-induced loss of tolerance or tilt. We know that the development of chemical intolerance actually starts with a trigger, and it's a trigger that is often an environmental toxin of some kind. It could be pesticides, it could be some kind of petrochemical, it could be some other toxic chemical. I was actually listening to this podcast earlier where they were talking about those chemicals that are used for dry cleaning and others. Implants of various kinds. They could be breast implants, they could be dental implants, they could be anything that's foreign in your body. These things can serve as an initiating event